My name is Doreen Gonzales. I'm the Executive Director of Southeastern Colorado Area Health Education Center. We cover the 16-county region in southeastern Colorado, which is a very rural and sparse area, but a very large area.
Well, thanks, Doreen, for joining us today and just spending some time to telling people about your COVID-19 story and how it's impacted you personally and maybe your work efforts at CAHEC.
Okay, great. Well, as far as our efforts through Southeastern Colorado Area Health Education Center, of course, we do a very diverse programming. So it's kind of affected how we connect with people. So no direct contact because we do many programs such as diabetes classes or oral health education where we're in direct relationship with our clients. We go out to the communities and we talk to people. We go to community events, school events to promote our programs. So it's made it very difficult, very challenging, but we have to think of our programs in other ways, which could be more indirect, but at the same time, some kind of connection to our clients in order to fulfill our programs. Like I said, they're very diverse, so it's from children to adults, seniors, and then we have very diverse communities that we go to, mostly rural, but also the underserved.
What's been your biggest challenge in working with your clients?
I think that the biggest challenge is that we cannot sit and talk with them. For instance, our diabetes classes where we're sitting around a table and we're teaching about diabetes self-management, that they can't really bounce off ideas off of each other. Let's say we have a class of 12 seniors and they want to share ideas. That makes it kind of challenging to ask a question within that small group that they feel comfortable with, that they get to sit amongst their friends, that they can ask questions about their chronic disease. So that makes it more challenging to have those one-on-ones also, where sometimes we do diabetes refresher courses, one-on-ones with people. They come to our office or we go to them in their community and to give them kind of a brief presentation on diabetes self-management before they go into the 6-week self-management course. So that's very challenging, as well as oral health programs where we're in the communities. Let's say we're at a community fair or a county fair where we put up a table and we engage with the children, we engage with their parents, talk about oral health care. So many of our programs are just that one-on-ones that challenge us to think in different types of connections. So for the most part, it's just working with our clients, seeing them face to face and working out their issues and teaching them new things or refreshing their knowledge on chronic diseases.
Have you found that most of your clients have access to internet and resources so they can connect?
I think for the most part, maybe cell phone service. Internet is kind of tricky in our area since we're in the plains area. Towns and communities are very far apart. To go shopping or to go to your dentist or your provider could be 35, 40 miles away, even more. So those communities, they're kind of secluded in that they don't have that internet access or reliable access to engage with others. So spotty at best sometimes, even where I live. I have to walk outside to use my cell phone because it could be really spotty inside. There's walls to kind of put up barriers to a good connection. Internet can be disengaged or disconnected at any time. So there are huge challenges to that. Maybe in some areas it might be a little bit better than others, but for the most part, rural areas put up with those challenges. We use what we can, otherwise we accept that sometimes it isn't the best.
So let me just get this straight. So it's the year 2020, we're in a pandemic, you offer all kinds of health education classes, really targeting oftentimes disadvantaged groups.
Mm-hmm.
And your primary tool to provide that education is a cell phone?
Yes. It could be cell phone or text. It's probably the most reliable. And so it kind of puts you at a disadvantage, even though, you know, we have that connection, but it's not reliable enough to have a full connection or reliable to finish a conversation sometimes. So that is our only tool that we feel that's halfway reliable in order to, you know, engage somebody.
So where are your clients and the student population that you're working with? Where are they getting their information if they can't get it from the internet?
I think for the most part, you know, I think that they use a lot of local television and radio. There is still some dependency on local radio stations, and especially out in the rural areas, farms, ranches, that they depend on radio and just local stations to give them information. Those communities, they're kind of on the edges of the state lines. They may get their information from Kansas or northern New Mexico or, you know, someplace like that, wherever their closest, strongest connection to television is, their strongest airwaves that they listen to. So I think for the most part, television and radio.
How is this event, in your opinion, affecting healthcare disparities and social determinants of health?
I think for those in the rural and definitely medically underserved areas, it's affected because, first of all, it's a hardship anyway. In normal, everyday circumstances in the rural areas, to get to a provider without traveling 35, 40 miles away, or that they're able to, let's say, go to a pharmacy or, you know, get health education. It just makes it 100 times more harder when you're secluded in an area. This pandemic is going on, and then you have the challenge of driving somewhere to go to a provider or other types of services. So those that are underserved or in these rural areas, you're kind of at that disadvantage anyway because of the social determinants of health, but this makes it even harder to do. You know, challenges are greater.
How best Well, you use the lessons learned from this COVID-19 experience to improve health education and even health outreach in your community.
I think for the most part, because of the lack of one-on-ones, the lack of working with groups of people in our programming and education pieces, is that we have to think of it as like a blessing to try other ways, that we can't just rely on one system or one connection to reach our people. We have to think in more creative ways. For instance, and I know this is kind of old-fashioned, but we sent out packets to communities in southeastern Colorado where we find people that could champion for us, who could do a distribution either by paper, or that they could share information at a town hall or a community building, that they're able to, because they're there, that they're able to share the information, post things for us in community or public places. So it challenges us to take a look at different avenues than we have before. We don't, and we should not rely on one connection. And we have been doing other social media for, as much as we can, that I think for the most part, people try to do that. I think now is probably people even trying it harder than, like me, who have not used social media as much, and you're challenging yourself to use it more. So I think most people are probably doing that. Kids are showing their grandparents and their parents how to navigate through those social media systems. But if anything, it's just to be open to other types of communication.
Have you seen any surprises where you're seeing new leaders develop in the community, people who maybe weren't in a leadership role traditionally? Are you seeing people in the rural community kind of rising up and helping their neighbors? What are you seeing in this event?
I think for the most part is the dependency on those professionals in our small communities. For instance, the county health director, where people probably didn't even know who the county health director was. That they're looking towards them more. They find them as this central piece to the community that's carrying the information, that they're promoting the better health environment. They're promoting information about COVID. They're outreaching more, so they're becoming more visible, where before maybe those people were more invisible. You had no idea what their role was. I think if anything, for the health professionals and the county officials, it's made them more accessible than before. People look towards them now. That's where they're getting their information, factual information. So I think those, if anything, those roles have been enhanced. Community members have, for instance, a small community in Otero County, many of people that sew are starting to make the masks. So the hospital's going by and picking up these homemade masks and taking them to the hospital to give out. So it's kind of like a community, kind of like a community event where everybody wants to join in. There's always something to do, something that everybody can do. And addition to just taking care of yourself, staying home, and following the safety procedures that are put down through the state or a local environment. So if anything, those people have kind of stepped up for the health or for the benefit of everybody else in the community.
What impact has this had on you personally?
Personally, it's been a change. Of course, a work environment, working on my back deck, working from home, challenging myself to keep my focus, but at the same time, I have essential duties that I need to go back and forth to the office to, and practicing safety guidelines to do that. So it's just different. It's a different environment. Maybe my focus has been challenged because there's so many other things that you just feel like this outside environment has kind of come into your life, your lifestyle. So, but you learn to adapt. At first it was kind of shaky. It was like, okay, what do I do? You know, and how do I do it? And what do I tell my staff? So you just kind of go with it, and everybody else, as long as they're practicing their safety procedures, they're staying away from the office, you know, we'll probably start easing into our offices here pretty soon, but for the most part, we're doing really well. I'm just proud of my staff and what they're doing. Even though we're working on a lot of administrative stuff, we're getting stuff done, which we had no time before, such as working on a student intern handbook when we get student interns, or we're working on other types of materials that we can use later on, like brochures. We're revamping those. We're working with social media on posting new things, such as our dental health program, kind of tidbits that we could share with others, sharing tidbits about diabetes self-management through social media. So we're gaining other tools, we're learning about other tools, but for the most part, I think I've adapted pretty well, and it's really opened my eyes to a different environment and how we can challenge ourselves to do better and find more creative ways.
How will this influence your grandchildren? What will you tell them about this event, and how should it be remembered?
You know, that's interesting that you bring that up, because my granddaughter lives in Bozeman, Montana, and her other grandma that lives close by had taken a picture of my granddaughter in the window, and her two little cousins are outside of the house window, and they're just smiling at each other. And you know, when she posted that, she said, this is kind of like the new socialization for, you know, and kids don't really understand, but they're adapting really well. They understand that, you know, when they can't touch others or have friends over or family over, sometimes it is hard for them to understand, but in a way they're so adaptable. But I think for my granddaughter is that she will remember throughout her life. And as we bring it up and talk about it as adults, she will remember how it affected her, how she did things differently, you know, that her cousins can come over to play. She wasn't going to preschool anymore. And it's just so different. She can't go shopping with her mom, you know. So for the most part, I think they will remember, and kind of I guess, open their eyes to, that things are stay the same all the time. Go to preschool, mom goes to work, and come back from preschool, and then we get to walk to the park, we get to go shopping on the weekends, we get to go to the movies on the weekends. She will remember. I think that's the greatest part about it.
Is there anything you want to share for Prosperity about your challenges, or some just amazing aha moments that you've had throughout all of this experience?
I think the amazing part that communities get together, for the most part, people want to abide by the safety rules and want to do the right thing and want to keep their families well and themselves well. I think if anything, people are just taking care of others and themselves. They're seeking out, how do I help my neighbor? How do I help my family? Precious that we keep within ourselves is the health of ourselves. Is that something you think that if one precious thing about what you could give to your family is to keep them healthy? So I think that's the greatest aspect, and just communities coming together, doing things, and to help out without being together. They're together, but not together, is how I can say it.
Well, thank you so much. And
you're welcome.
For all that you do.
Well, thank you for asking me to do this. I really appreciate it. It was fun.